I'm Dr. Jordin Wiggins, and this is the Pleasure Principles podcast. Join me on this journey where sex, science, and sensuality meet. Let's change the conversation around sex and pleasure together. Hello, Superwomen. I am here today with Dr. Audra Lance. She is a friend, client, most importantly, celebrity doctor, sports and non-surgical.
Sports and non-surgical injuries. So I essentially get to the root cause of your pain.
And she's going to get to the root cause of my pain today.
Ooh, up for a challenge. Okay.
Yeah. So, and I mean, it's via Zoom. So we will see. But okay, no, for real though. So a big part of my work in getting, well, I think a part of the reason why I love you is because there's so many parallels to how you approach pain and care, like injuries, and how you look at things. And I'm doing the same with cellular health and women's sexual health. So do you want to give us a little background on what you do first, and then we'll talk about me?
Okay. Well, yeah, I feel like there is a disconnect in our medical field of how we treat pain, essentially. I think everyone just looks at where you're feeling the pain or your symptom, whether that's, TMJ, bloating, constipation, plantar fasciitis, and only treating the site of where you feel the pain and not looking at the whole global pattern. Because a lot of times your foot pain can be coming from your low back, or your TMJ is coming from your pelvic floor. I mean, we have to look at the whole global picture and decipher what the body's telling us. And I feel like, I know Canada's just like the US with some, you're trying to see people in 2 minutes and, oh, it hurts there. That's what it is. Instead of being like, oh, wait, what's the body telling us? Where's this coming from? And even addressing the level of the nervous system, like your stress component, your trauma component, and even therefore another step is the mindset component. How are you approaching this? I work, like you said, with a lot of celebrities and professional athletes, and you have to address all three things or you're not going to be able to level up and get the edge.
Exactly, which is my approach to like cellular hormonal health and sexual health, because it's not just, oh, well, I don't feel like myself. I want to feel normal. Must be my hormones. And it's like, oh, no. It would be lovely if it was that easy and I could write a prescription and balance their hormones and they'd be on their way. But it is so much more complicated than that. So let's use me as like a little case example. Well, right now, everything hurts, but I have a fever. So, okay. So my history, I've had chronic jaw pain, like TMJ. It's just sort of something. And again, we're going to call me out because it is something that I live with and don't address. Like every once in a while, I'll go get, massages or an osteopath. Like I'll have people work on it from time to time when it's really bad and I like can't open my mouth to eat a burger, but I just live with it. I just tolerate the pain.
Yeah.
Classic.
Like a superwoman.
Yeah. Like a classic superwoman move is just like, we just push through, just keep.
And you think it might just go away one day.
Yes. Or because we know the real thing is that I'm just going to tolerate it until like something happens and then I need dental work, or there will be a bigger consequence to me ignoring the pain. So that I've had, like, I honestly couldn't even tell you. I used to wear retainers, which I probably should, since after braces still do it, but me. And I would like chew through them. Like that's how clenched my jaw is. And there's periods, like it comes and goes, and there's periods that it's better. I also used to have pelvic floor pain, which will flare a little bit when I'm stressed, but I have my exercises and my wand and my things that I can know how to do to help my pelvic floor. But when that's flared up, like sex is painful, hurts to orgasm. And yeah, I find even like period pain is worse. Like I'll feel like my uterus is going to fall on the floor sometimes.
Yeah.
And some people would think that none of these things are related, but you're going to tell us how. And then I have this right foot pain that I have had on and off, and I only feel it at night usually. Again, and I think I'm just too busy and disconnected from my body probably during the day to feel it. So when I stop at night, it's like, oh, but yeah, I've had that probably for like 8 years. So tell us.
Yeah.
Tell us how you would look at this, because we know that a lot of ladies listening have some or all of these things.
Yeah,
and they're ignoring it too.
Yeah, or more. So first off, I do work with people virtually, so I mean, it can be done. And
yeah, and I was also gonna call myself out even more. I bought your game plan for plantar fasciitis. I've also told a lot of other people to buy it,
and you haven't done it.
No. But it is not because of you, because I know it's amazing and it would actually help if I did it. It is me ignoring my needs. So this is, and we know I've had a lot going on in my personal life in the last, 6-8 months. But again, no excuse to not prioritize myself. So game plan, virtual. We'll tell you more about those later.
Yeah. And I think we're similar in the fact was you didn't have to make a big enough investment for you to show up. Like you made an investment.
I know we're the same and our clients are the same. And it's just like, if like a couple $100 and no one holding me accountable, it's just like, oh, I'm going to do it tomorrow or I'll do it.
The pain's not bad enough yet.
Right. But it's like, and super women literally need to be like crippled to do something about it.
Mm-hmm. Even though it takes way longer and is harder for you long term, like it is easier. And I preach this all day to nip it in the butt, but I can't say that I do that. So I'm like not mad at you for waiting.
I know.
But I mean, and in a perfect world, you'll feel better. You'll perform better. You'll be happier. You'll be more in the moment if you deal with some shit now.
I literally tell people this all the time. Like, let's not wait until your marriage is like you're actually filing divorce papers. Let's work on like this, or let's not wait until you have the breast cancer diagnosis. Let's like work on this ahead of time.
Absolutely. Sometimes it works and sometimes it doesn't. I mean, I'll call us both out, like, because I have stuff too. Before I started working with you, like I waited till it got really bad because we're taking care of everyone else and not ourselves. Which, when you are feeling your best, you can take care of more people. Anyways, I digress. But so first you have a lot of things going on and like you thought they were separate, but they are actually all connected. So first I would look at your history, which you gave us a little bit of it, but knowing you a little bit more than that, I kind of have that in my head. You are stressed all the time right now. And people don't talk about how your pain is worse when you're stressed, even though you can push through it. And you kind of just like, we're taught to hold, especially as super women, like we just hold it in different parts of our body. So a lot of people are like, oh, my neck, which your TMJ pain, 80% is related to the neck and vice versa. So if you're just getting massages on your jaw, you're not fully treating the neck. Then we dive deeper there. Like, what's your resting mouth position? And little preview, your resting mouth position influences your pelvic floor, which then influences your foot. So if you're sitting there clenching,
and this is interesting. I'm learning too, because when I learned about mouth and like mouth position and like sounds that you can make through Chinese medicine and through like midwives and natural births and just like tantra and anal sex and orgasms. And like I learned about that connection, but I did not learn about how it connects to the foot too.
And your pelvic floor connects to the foot, and like so does your low back. So that's why a lot of like foot stuff, if you're not looking up at the whole pattern, and then everyone says your core, and everyone thinks 6-pack. Well, that's wrong. I mean, if you have a 6-pack, that looks hot as hell, but I guarantee you're probably dysfunctional in your pelvic floor and or your low back because you're not stabilizing correctly. So then your pelvic floor is like the diaper of your core, and we don't want it to be a saggy, gross diaper leaking out poop. Like we want it to be the tight, cute boy shorts or the boxer briefs hugging all the right areas. And so we need to make sure we don't need to make it stronger. You're already strong. You're standing up, you're moving around, you're lifting your kid, you're doing what you want. That's strong enough. You're able to move. We need to actually learn how you can connect to feel it, to relax it, and be able to activate it correctly. And I know this all seems super overwhelming, but you take it bit by bit. And there's just like simple things. Like if you do one thing, it can influence the whole pattern, which is part of the fun. It doesn't have to be so daunting. Like, and that's probably why you also haven't gotten help. You're like, I have all these issues. I don't know where to start. And it's going to cost me so much work. Like they're going to give me 30 exercises. I don't have the time. And it's like, no, like, let me help you break it down. We'll start here and then we can progress, which is part of the fun too. And it's like the puzzle. So you got, the musculature, but then you have the nervous system, which we need to address, of the stress. Like, are you taking, I like to preach, like 30 seconds to yourself? Are you doing that every day?
Yeah. Yes. I have my 4-minute meditation that I do.
Ooh,
and I have times throughout the day
okay.
that I do anchor to calm my nervous system, or else there is no way that I
Yeah.
would have been able to handle the
Yeah.
last
And
8
you
months of
taught
my
me
life.
the pleasure practice, which I think is the next step up after you're able to take 30 seconds for yourself. Then, like, the pleasure practice that you preach and taught me is huge. So you're already doing that because that's your thing. And then
Yeah, and my pleasure, truthfully, my pleasure practice has been down a bit, but I am still.
and then just your mindset on it, like back to, you probably think it's so daunting. What if instead you were able
It's
to
like
know, okay,
one more thing. It's like, oh,
yeah,
one more thing that I have to deal with. Like I can't, because these other things are important,
right.
which is
So,
so backwards and so hypocritical. And the fact that I'm saying it out loud is like,
but I mean, I agree. I came to you thinking it would take forever too for my hormone stuff. And it's just like, no, we can break it up in manageable pieces and one thing will affect the other. Give me 5 minutes a day, give me 30 seconds, something to start. So, I mean, a lot of your symptoms and everything you're talking about is what I'm hosting on January 9th, the Restore Your
tell
Pelvic
us
Floor.
more.
It's at 11 Central, but once you sign up, you'll get the link to have lifetime access. So if you can't be there live, you can watch the replay and then you can keep going back to it to like get clarity and have me walk you through the exercise. I mean, what I'm going to teach you is going to help influence all of that from your couch, the comfort of your own home. You can be in your cute boy shorts while you do it, whatever. But when you're live, like, have some clothes on probably because everyone's going to see you. And we're going to have some fun and like actually dive into restore your pelvic floor, nervous system wise, and the exact exercises. And another little
And I
tidbit,
think,
it's going to be kibosh the Kegels. Like, it's the answer is not the Kegels.
yeah, no, because
Please.
I was going to say this, super women, I think, and correct me if I'm wrong, but it's more of like a hypertonic, like a tight issue. Like you
Yes.
said, it's not being able to relax. I know that was my issue. I went to a pelvic floor physio 10 years ago thinking that I had to like hone my pelvic floor tighter. And I had, I mean, I wouldn't say like a 6-pack, but like pretty toned
And
abs.
right.
And she's like, no, this is a hypertonic issue. This is a tight issue. And then we can get into the, tight vaginas. Ladies, you don't want a tight vagina.
Mm-mm. Mm-mm.
Tell us why.
That's costing you stability everywhere else. So you're going to have these issues show up. Constipation, bloating, hip pain, back pain, neck pain, TMJ, constipation, GERD or acid reflux is coming from your pelvic floor a lot of times in conjunction. Not that there's not a chemical component, or an hormonal component, which you address, but from a musculoskeletal component, manual therapy of where my specialty is, like that contributes.
I love how our work fits together so well.
I know, it's magic.
And yeah, but it's and from a sex perspective specifically, because I know that's why a lot of you are here, a tight vagina, it's this myth, like, and it's a bit of man math because, so a vagina gets looser the more men that you have sex with, but it doesn't get looser if you have sex with one man a number of times. Like there's so much stigma and everything around it.
Absolutely.
But if we break it down functionally,
mm-hmm.
like even like you want a vagina, a pelvic floor that can like relax and receive and can accommodate pleasurable things in when you are ready for penetration. And if it's tight, like, and it can't relax, sex isn't as pleasurable. I have a lot of women that tell me their vaginas are numb. Well,
Well, yeah.
guess what? Your vagina will not be numb when you learn how to relax it,
Uh-huh.
which is what I found. Like, we get more pleasure when we can learn these tools. Do you know, like, is there a reason why?
Well, and like, just to piggyback on what you said, like if you're dry as a desert too and not wet as a waterfall, I mean, this is all part of the function. It's not that you don't have the chemicals in your body to do it. It's just your nervous system and your musculoskeletal system and your hormone system. Everything is so connected, and you have to be addressing all of them. But back to your question of, yeah, those muscles, if you can't, if you're tight ass, literally, I mean, your butthole is part of
That
your
was
pelvic
me.
floor. Yeah. Your butthole is part of your pelvic floor. That's why I preach all the time. We need to learn to breathe in our butthole. Because like you said, most people, including myself before I started this work, is like, I didn't even have a connection to feel. Like, even when you're sitting down, like, can you feel your butthole? Can you feel yourself breathing in your butthole? That is so part of that whole musculature system of your pelvic floor. So if you're so, like you're saying, disconnected, your brain can't figure out what those muscles are to tell them what to do, to relax. And when they're too tight, you get leaking, all these other functions, because it's not about, like a bicep contracting. We need to be able to elongate and hold that contraction out there. Same with squats. Like, you shouldn't just be doing clamshells. I mean, you need to do that eccentric loading to get that full glute activation.
I am so proud of myself that even in my febrile state, I remembered eccentric contraction. I'm like,
Yeah,
I'm very proud of dusting off the cobwebs in my brain from med school.
I know. If you don't use it, you kind of lose it.
Yeah, you do.
Same with your
Okay.
vagina.
Right? Yes. So, and I when I tell super women, it shocks me a bit because I've been doing this for almost 10 years. So people that are new to me, new to my world, even women that have worked with me are like in the mentorship, and I tell them about like extended orgasms, like long orgasms, full body orgasms, multiple orgasms. And then they're like, it's possible to have a like orgasm that lasts longer than 3 seconds. But I think it's everything that you talked about, right? So if we're
Mhm.
disconnected from our pelvic floor and we don't know how to relax and contract those muscles, and our nervous system is in a, like, we have nervous system dysfunction, we have adrenal dysfunction, our body is like stressed out, we're like tight, like that,
Mhm.
tight ass thing that you mentioned, we're not going to have the best sex and we're going to have pain,
Mhm. Mhm.
and then we're
And
going
that
to be
bleeds over to
crustier.
all the other areas of your life, the
Yeah.
TMJ, your feet, everything.
Yeah. And yeah, we like to think about it so isolated. And then the suggestion that Kegels should be the answer, it makes no sense. And I think it's clear, but do you want to tell people why Kegels are not the answer?
Because a Kegel, when you're doing that motion, you're contracting more. So you're like sucking up, sucking in, right?
Is
You're
anyone else doing them while she's
yeah.
talking?
Okay, but it was already contracted before you did that. So you're just facilitating more tightness, more strain, more trigger points. And your brain then just gets, okay, well, we don't know how to do the other contraction, which is you need to squat, to run, to pick something up, to have sex, to, move in general. You need to have that be able to relax. It doesn't need to be squeezed up and tight. And I also would like to acknowledge, like, this is not to throw shade at any OBs, GYNs. Their job is not pelvic floor rehab. Their job is to prevent you, from cancer or something in your vagina and deliver a baby and make sure you're alive and the baby's alive. Like, that is what they specialize in. And I kind of preach that of all medical things. Like, don't expect to go to a surgeon and them to rehab you. Like, their specialty and how they learn to fix stuff is surgery. Well, same with an OB and GYN, like their specialty. Yes, I know it's vaginas and stuff, but it is just more in the delivery, scary stuff, cancer field.
Exactly. And it's like, do not go to them to restore your hormones either,
Girl,
unless
preach
they've
it.
done a shit ton of continuing education, but they do not learn it standard in school.
Yeah.
And
And I like to tell people this all the time. One of my best friends from college, well, I have two. One's a dentist and one's a dermatologist. And they would call me and ask me to explain, because I was in the cadaver lab dissecting bodies for 2 years. So they would ask me the musculature stuff, and I would call them asking more like, the pharmacology stuff, because they get more of that. So it's like, I think there's just, if you go to the MD, the, OB, whatever, they should know everything. Like if someone asks me a dermatology question, I go, I have no idea. Like when you go to the dermatologist and ask me, like, let me know what they say, because that's a good question. Like that's not my specialty.
Yeah. And if we all do what we're good at and people seek out the right care, because if you're going to deliver a baby, don't come to me.
Right.
I don't know.
Yeah. Maybe in an emergency, I can, throw some things together, but don't come to me for a perfect experience.
Yeah. And the whole system is just so disconnected. And I think that's why you and I, like our clientele is who it is, because it's such a specialized area. Their nervous systems, what they tolerate, what they want to achieve in life, like they're performing at such an elite level that if you don't look at it holistically, it's not solving the problem. And that's why I have so many people that come to me. They're like, I have the best concierge doctors. I have, whatever. I spend tens of thousands in other functional medicine people, whatever. And your treatment plan worked. Well, my treatment plan works because I'm addressing the whole person, mindset included, like you said. And these, like the level of stress, and specifically, I think women and what we have on our plates and what we expect of ourselves, both at work, at home, in our relationships, like it needs that special approach or it won't work.
No. And you have to have the time to do that. Like it can't be done in 2 minutes. You have to like get to know the person and figure it out. And I also think people, put doctors on these pedestals, which is great. Like, we've gone through a lot of education and we care, but something that's different with you and I, we've been through this ourselves. Like I was graduating school over 10 years ago and I'm young, 5, let's say 24. And I started peeing myself. I had never had a kid. I was throwing up every morning, dry heaving because of the stress. Like am I going to start a new practice? How's this going to work? I'm going to babysit on the side. I mean, it was a lot. And then that's what threw me into this passion of, hey, I'm already in this specialty doing like high level non-surgical stuff and injuries and like manual medicine. Let's dive deeper and evolve and go around the world, figuring out the best concepts and putting it together along with, the mindset nervous system component. Like it's not just one thing, it's all of it put together. And like, I had to heal myself from that and figure it out. And then I was doing case studies in my office with the patients to heal them. So like, I've been through it. I know what works and what doesn't. And same with you with the super women and the hormones and like the fighter, like you were sick too and healed yourself.
Yeah. And more than once, because that's when we go through our superwoman cycle, because we tolerate until there's some type of crash. So tell me, and then we can talk about this workshop because I know everyone is going to want to attend on January 9th. Is there some simple stuff that I could start doing for my jaw, pelvic floor, foot?
Yeah, I mean, I have the free Breathe Out Attention series that you can access on my website. We can drop the link in the show notes. And it's a 3-part, like there's one for when you're sitting at work. If you're just like, hey, I have a break between clients, put it in your earphones and do it for a minute. There's one before you go to bed, and there's one for like traveling. So when we're in the airport, when we're in the car, you're in the pickup line, just put it on, because we need to be able to stop holding our breath and actually breathe. Because when you hold your breath, you're costing yourself, again, stability, strength, relaxation. And then, holding that breath like makes you crazier. I don't like the scientific thing. You know what I mean?
Yeah. Oh, totally. And I think a lot of us are a little like crazier, crustier than we would like to be because we aren't breathing. Our nervous systems are like, we're not sending safety signals to our bodies. We are sending like panic, put out fires, like I need to fix.
And then another thing I tell people to do that's free is just set your alarm 5 or 6 times a day. You can put it on silent on your phone so that it'll come up and just, it says breathe or something positive and breathe. And right when you see that go off, just take a couple deep breaths. It doesn't have to take up a ton of time and be hard. I had one client virtually. We just started there because, we were getting into everything, the first visit. And I was like, listen, we're not going to pile a lot on you. Like, let's just do that alarm thing. And she goes, just doing that, there was way less leaking. And I was like, yeah, so we're on the right track. It can be simple. It doesn't have to be so overwhelming and strenuous.
I love it. And that's with all of my teaching. I know that like women don't have an hour extra a day, or like it's got to be what can they do that's going to be easy, quick, and effective that they can see a difference. Because I also know with high achievers, like if they're not going to get a result semi
They're not going
quickly,
to do
then
it.
they're going to be like, fuck this.
Yeah.
I'm
Yeah.
out.
If they can't see the benefit, I mean, makes sense.
Yeah. Okay. So tell us about the January 9th event, Restore Your Pelvic Floor. Tell us why we need to attend.
I mean, are you struggling with leaking, constipation, super stressed out, feel like you can't calm down, bloating, hip pain, back pain, TMJ, jaw pain, acid reflux, foot pain, neck pain? You feel like you don't know where to start. Like you're so overwhelmed. You're like, I mean, I know I have all these issues, but is it actually, can you like feel better and get fixed? And just you kind of feel like helpless, and or maybe you've tried a few things and they haven't worked, or you've been told to do Kegels. Like you better be on here if you've been told to do the Kegels, because we're going to kibosh the Kegels.
Yeah.
And we're going to have fun. Like it doesn't have to be so uptight like a tight ass. Like we're going to relax your butt and breathe in your butthole and just like have fun. You're going to learn exercises and actionable steps that you can take to help yourself immediately while having fun.
Love it. Love that it's going to be fun. Love that we're going to be relaxing things, because when we are a tight ass, and I remember this, I was doing my pre-med degree and it was the first time that because I had like debilitating pelvic pain at the time. Even I'd gone to the ER a few times and no one could even diagnose it. And it was that classic pain, like in between my vagina and my rectum. And everyone's like, we don't know. Let's check if she's pregnant. And then I went to a pelvic floor PT and she's like, you're a tight ass. Like your pelvic floor is so tight. How people would even relate to me then was different. Like when we can learn to relax and receive, it totally changes the dynamic of how you feel about yourself, how people relate to you, the sex that you have. So
what kind of boss you are, what kind of person you are in your relationship, what kind of friend you are, how you feel about yourself. Like I've experienced all this combining my work with having you on my team too. So it's just been a whirlwind and exciting.
And watching it change everything in all the areas is amazing. And then when I'm meeting other women and it's like, oh, like she is an untamed superwoman. She's a tight ass. Like we need to help her. We need to like bring her in here, give her a hug and help her learn how to.
Well, because you get the edge, like it opens up so many things. And like one of my fears was always like, is this going to set me back? Like, do I need to be this uptight? Like, this is what's got me so far. And it's like, actually, no, it's actually going to give you the edge and go to new heights that you didn't know you could even obtain. And I know that sounds almost wild, but it's so true.
When we're in, and I get that objection every time. It's like, well, like, look at what I've built. Look at what I've accomplished. Like, they think they're going to turn into this like flowery running through fields, like meditating 10 hours a day. Like, no, like that's not
what I tell people is if I have professional athletes and celebrities who everyone thinks they have all this free time, they don't. They're scheduled out every minute. If they're making it a priority and they notice such a crazy change like they have, or they want to refer people, they want to provide recommendations, they want to keep coming back. I mean, you can do it too. I mean, mic drop.
Yeah. She's calling me out. I need, why am I not prioritizing my pain and pleasure? But yeah. And then we get into, this is a whole other conversation. We'll have you back, but it's like worthiness
and trauma.
Yes. I literally had a woman on a call the other day. She wants to do the mentorship for 2024. And she's like, I know I need this. I can totally afford it. And she's like, I think I'm just having a really hard time thinking about spending the money on myself. And she's like, whoa, like it means I need to do it. Like what we're resisting,
Oh, you got to
the
lean into.
pain, the shit's going to resist. Yeah. Until we lean in, and it will be more fun than you
and
ever
when you're
thought.
the most uncomfortable, you grow the most and it becomes more fun.
Yes. So come have some fun with us. Join us, Dr. Audra and I, January 9th. Restore your pelvic floor. You will learn so much. It's going to be fun. And we are going to have a very exciting announcement for you. We're teaming up, and you're not going to want to miss it. And we know you're busy. There is a replay available, but we're putting the link in the show notes. Go right now, click it, sign up for January 9th, because we know you're gonna, if you intend to do it later, but we all know you won't because you're too busy.
I
so
love it.
Go click it. Cannot wait to see you all on the 9th. And I mean, what's going to be more fun than that? We can play a game for like how many times we say butthole.
Ooh, I like this. We're going to have to think of something like that. I like that.
Yeah.
This will be fun.
Me too. It will be. Okay. So we'll see you there. Dr. Audra, thank you. We'll definitely have you back.
Well, thank you very much. This has been so fun. Love you.
Love you. Have a great week, everybody. If you like what you heard in this episode, leave me a rating. Your support helps me get discovered by more women like you. Together, we can change the conversation around women's sexual health and pleasure for you, your partners, and generations to come.